The American University of Antigua Roundtable, Healing the Healer, brings you a robust discussion. We have with us tonight Dr. Shah, Dr. Matthew, Dr. Rao, and Dr. Nazareth giving us their perspective. So, Dr. Rao, this question I think would be more relevant to you. The 22 months or little more that we have seen changes to life balance, to work balance, to everything, any balance at all, and robust intervention by doctors who were, like you mentioned, not in the hospital practice, but called in because you were needed. Do you think that this is something that is going to be ongoing for a long period of time? Or do you think the hospitals are gearing up to put things right as it was before the pandemic hit us?
That's a great question. And I think that we have to look at priorities, and that can be quite tricky. And right now, the priority is being patient-centered. So our priority is to make sure that we are taking care of our patients and keeping them healthy and keeping them alive. I do think that is quite tricky because at the same token, we have to be taking care of our healthcare workers. So I don't think that this is going to be something that is going to be resolved within the next year or two. I believe that in the background that many administrations and hospital systems are going to continue to work on the barriers, the challenges, and the issues that keep arising. Because if we do think about this, the healthcare system was struggling pre-pandemic, and the pandemic purely amplified the issues and concerns that we are seeing now. So I don't think it's something that's going to have a short-term or even an intermediate resolution. We're looking at more of a long-term resolution.
Sure. So, Dr. Matthew, I know you, obviously you're one of our senior alumni and you're in a very senior position at Temple as well. And I've been sort of sitting in on discussions where they're talking about organizational interventions, reducing the burnout, a supportive workplace, including supportive leadership at the level of director and manager levels, professional development, all these are words that are flying around. Do you think any of this is realistic? You work for one of the larger hospitals. What would you think would work?
I think there has to be institutional change. I think there's definitely a cultural change. I think the value of physician or any support staff has definitely increased over the past year because they realize that without the frontline staff, whether it's a physician, a nurse, a CNA, or whoever it may be, the patients aren't cared for. So I think there is an institutional change. I think the institutions have realized that they need to protect their staff. They need to provide adequate equipment. They need to provide adequate mental health support. And that the burnout and the loss is a problem. In addition, as others have mentioned, there's also a loss of staff from having to care for loved ones. One of the big problems that we had around the pandemic is there are parents that are both in healthcare, and now kids can't go to school. So what do you do with those children? Who's going to watch those children so that parents can go to work? And those are things that now the institutions are addressing. They are the institutions that were not involved in that are now getting involved in, how are we going to provide adequate childcare for our employees to make sure that works, which, in other parts of the world is part of employment and, job contracts and things, which hasn't been a focus here in the US. But I think those things are coming to light because those things were really big issues that happened during the pandemic.
Very true. Dr. Nazareth, when you and I spoke, I think about 3 weeks ago, you had mentioned about your hospital trying to implement some support systems for the healthcare. Can you just elaborate a little bit on that?
We are, especially in the psychiatry department, extremely passionate about trying to take care of our workers, be it the CEO, be it the doctors, be it the nurses, be it the custodial staff. They worked their butts off too during this pandemic. And so we have implemented certain things that we started during the pandemic as a kind of, okay, let's just take care of them right here, right now. Things that have actually become part of the policy. We have implemented staff wellness stations where you can go. Some of our therapists from the psychiatric floor were there. If you want to talk, you can talk. If you want to color, if you want to eat, if you want to anything, that space is available to you to take that 10 or 15-minute break and recenter yourself. We also have implemented what we call a recharge room. This room is set aside from the floors. It has its own keypad. You can sign up and go in for 15 minutes. And they have different, on a projector, they have different scenes that are tranquil or that are energizing. There's campfires, there's waterfalls, there's whatever you feel will help you escape for 15 minutes. You forget you're in the hospital. You forget you're covered in patients, whatever, and you enjoy yourself for 15 minutes so that when you go back, you can give your all to the patients, because really all of our staff has given everything they have to give and more. It is our job now as the institution to take care of these people who really may not have signed up for this, and there's no end in sight.
Yeah. Well, that's the thing, isn't it? I don't think anybody signed up for the pandemic. I mean, I think
it was easy when we thought it was going to be 3 months or 6 months. You saw the end of the road. Now, especially with a new variant, we really don't know when this is coming to an end. And so taking care of our workers' mental health is so, so important. And really, my institution is trying to take that very seriously.
That's really awesome. And I think this recreational room is needed everywhere, not just in hospitals. I mean, I would love one in our office, I think. Just shut the world out for 15 minutes, give me a break.
It's been wonderful. I know I use it. You can take off your shoes. You can have that 15 minutes where you're just not there anymore. It's an escape. It really is. And it totally revitalizes you.
So what do you think is priority, Dr. Shah, in getting the world back to, or the healthcare world back to what we knew it as? What do you think they need to start doing?
It's $1 million question. We have so many smart people, intelligent people, scientists, researchers, of course, entrepreneurs, and we have a minefield of intelligence, and we still probably don't have an answer to that particular question. But what I do think, knowing from my professional understanding, is that what we have lost or probably not gained much over the many 2 or 3 decades is enough resilience or buffer to allow us to change with the uncertainty or the volatility of the world, or even in our day-to-day lives, whether it's work or family. We have probably gone into a bit of some people call it a rat race, where we don't know what the overall purpose of the life is as well. So it goes a lot more deeper, and we all may have to rethink about our values and what we are doing. Is it in sync with those values? So that goes at real deep level. If we don't, no matter what's thrown in front of us, we will struggle. So as a society, as a community, as a globe, we need to really, really rethink. The other thing I do think which does need to change is there's a tension when it comes to healthcare, or when you call the hospitals or community support and patients. The tension is generally around the economics as well, in terms of the cost, the value added activities, and others. And when you have that tension between the administration side, which is right to have, and then the healthcare professional or doctors and nurses whose main job is just to look after the person who's in front of you. And that tension is completely misaligned with the purpose and values. I think we really need to try and work on that aspect. That may help us to not have this compassion fatigue after many months of this, probably we'll be able to revitalize and recharge as all the efforts have been put in, as we just heard, into that. But I think it is a lot more deeper introspection that we all as healthcare professionals have to do. And I think medical schools are perfect grounds, and nursing colleges are perfect ground to build those attitudes right from the beginning.
That's wonderful to hear, because at AUA, this is one of the things that we try and incorporate, empathy and have focus on what you're doing, know where you're going. We can give you the academics, but the rest of it you have to do yourself. So that's definitely something, I'm glad we're on the right track. AUA Roundtable Healing the Healer will return after a short break.